So are we ready?
This is Jay,
This is A,
and this is Moxicated.
where we drop the booze and walk through the reality of life alcohol-free.
So grab your favorite mock, get ready to laugh, and let's get Moxicated.
Oh,
Hi.
see, every time. Welcome to Moxicated.
We are back, and we are back with a guest, which we are so excited to have on
Yes, we are.
because as moms, we haven't really gotten to cover a lot about moms.
Yes.
So before I get into that, we are going to introduce our guest, Elizabeth Garchar. Say hello.
Hello, thank you so much for having me.
Yes, you're welcome. Tell us a little bit about who you are and what you do.
Yeah, for sure. So I'm a Northenia. I'm from Santa Fe originally, and I am also a MD. I did all of my training at the University of New Mexico. So I did undergrad, med school, residency, and fellowship to
Yes.
specialize in high risk pregnancy at the University of New Mexico. So I specifically look at high risk pregnant mamas, and I love my job. It's so beautiful to be a part and a privilege, honestly, of these women's very special moment in their lives where they're having their babies, and all birthing people as well. It's been a really special journey to go from doing that as a provider only to becoming a mom myself. I have a 7-year-old, a 3-year-old, and a 3-month-old. And so I love taking care of my little people as well. And it definitely changes your perspective on pregnancy when you have your own, that's for sure.
Oh my
Yes.
gosh, yes,
Ah,
totally.
Jess has 3 kids too.
Yeah, I'm 7, 6, and 3. So,
Oh, that's awesome.
and I was actually high risk for 2 of them. So
Oh,
it is,
wow.
yeah, it is such a, you mentioned like being there for moms when they're in this transitional, amazing period of their life. But I think also when you do have a high risk pregnancy, like you rely on who is the medical staff in your life so much, and they can be such saving graces for your mamas that are going through something that can feel scary.
Yes.
Yeah. No, definitely. And that's one of the things that I definitely strive for. I remember so much more, I think of, my birth experiences from like the nurses or them helping me clean up after having a baby or those kind of things that are like very intimate and also like not something that people are like, oh, the doctor who caught the baby or whatever. But I feel like you can make a huge difference with small actions in those deliveries. And for me now I'm all prenatal, so I do ultrasound primarily, talk to people about different diagnoses, and then guide other OBGYNs who actually deliver the babies on what the plan should be.
Wow.
Wow.
Okay, that's so cool. Is this
Yes.
something that you, once you entered into the medical field, was this something that you always wanted to do as help in like maybe labor and delivery, or did you have an experience that kind of made you be like, that's where I want to be?
Yeah, no, I always laugh and say that it's a mark of an OBGYN to have said at some point you would never be an OBGYN. Because I definitely was like, oh no, I couldn't do that. And I was gravitated towards it just more and more and more. And actually, yeah, my rotation as a third-year medical student, you go through every specialty. Well, overall, you go through the big specialties like neurology, internal medicine, family medicine, and one of them is OBGYN. And it was my second to last clerkship, and just the moments with people and how much of a difference it made to have a good versus a less, maybe someone who's a little more burnt out, right, provider, made a huge difference in how these women were treated and how they came out of those experiences. So I wanted to be a positive influence as much as I can on that.
Oh my gosh, that's so
So
cool.
cool. I'm kind of mind blown. You're very cool.
Oh, you guys are cool too.
But to like know, to have what, pushed you to this position be like the people. And we need medical doctors and professionals like you. Seriously. It's like I'm like thinking of all the people that you've probably helped without even meeting
Yeah.
them, because to have that type of passion is so special. So thank you for everything that you do. It's so awesome.
Yes.
Oh, thank you so much. Yeah, I especially loved having baby or delivering babies while I was pregnant. That was always such a special connection to be like,
Yeah.
You can do this. I'm going to do it. We got this. Yeah.
Yes. Oh my gosh, that's such a good one.
Yeah, I probably would have been like, we're in this together.
Yeah.
Yeah, for sure.
Um, so for some of our listeners who may not know, what is a high risk pregnancy?
Yeah, so I feel like there's lots of definitions, and I usually say there's like high risk light and then like truly, really high risk pregnancies, right? And so the most common things are either mom differences or baby differences that make someone high risk. So if you're over 35 years young, as was I with my third pregnancy, technically you're a high risk pregnancy. But I would say 40 is when that actually becomes a reality of increasing risks significantly of things like early babies, small babies, those kind of conditions. And then other stuff that I see commonly is things like diabetes in pregnancy or outside of pregnancy, definitely increasing, and also a BMI. Although I'd say the body mass index or BMI is kind of an antiquated system and in a lot of ways is used to discriminate against patients in some things. And so it's important to use that as a tool rather than as a way to say, oh, all your problems are because you're over a certain BMI. And then baby things can be lots of stuff. Any differences in babies, if when we do the ultrasound at about 20 weeks or so, the anatomy ultrasound, if we see differences in that ultrasound, that could make someone high risk because of the things like heart defects or differences that we see that we're concerned about.
Wow.
Okay. And is there like, if there is, high risk in the mother, can there also be high risk in the baby? Like, how often do those things go hand in hand, or is that more kind of by chance?
It can be both. It's more common to see certain things run together. So, like women who have diabetes, especially not well controlled before pregnancy, are most likely to have heart defects in their babies. That's the number one cause of congenital heart defects that's modifiable, is having uncontrolled diabetes before pregnancy. So that's something that definitely goes hand in hand. And then young women have more pregnancies, right? Like the younger you are, the more likely, and now actually the average is about 27, 28, depending on where you live and different factors. So a little bit older, but that group has the most babies. So they're the most likely to have babies with things like Down syndrome or other conditions that can make babies appear different.
Wow.
Wow.
Okay, that's a really good, like, to point that out.
Yeah.
Yeah. Um, I'm asking because it's interesting to be told you're high risk pregnancy because I didn't have that much going on with myself, but did have something going on with my baby, and it's nice to know like the definitions or the differences. I think
Mhm.
that I always thought something was wrong with me. Like I'm like, why am I high risk? Like what's going on? I didn't get it explained to me, you know what I mean? So to be able to have those two definitions is very nice.
Yes.
Um, and I think, you hit a lot of the major causes in high risk, especially in women and babies. And is there any like other potential outliers that you guys focus on when it comes to potential high risk in mothers and babies?
The other things that we always ask about, I would say the main thing I ask is things that are modifiable. So things that we can change by our behavior. So things like fixing diabetes before pregnancy. Also, asking about things like substance use or tobacco use, which ironically, smoking used to be the thing, right? And it wasn't until the 50s they realized babies were getting small from smoking. And then they really publicized that in the 80s. That I always say when you have a growth restricted baby, if you're a smoker, that is the biggest thing you can change to fix that. And that can make a huge difference even during pregnancy. So, stuff like that. And then, of course, alcohol use as well is another one that we definitely ask about. And it's something that can be modified and can change the trajectory of a pregnancy.
Wow.
What percentage do you see high risk that is alcohol related?
It's so hard to quantify, right? The national statistics say they think it's about 2 to 5% of babies are born with some alcohol spectrum disorder. So fetal alcohol syndrome is what people think of, and that is the most severe. And so that's less than 1%. Those children have differences in their appearance. They have a smooth upper lip, the space between the nose and the lip, that's called the philtrum. So that looks very smooth, and also a thin upper lip as well. and generally smaller appearing eyes. They're generally smaller and have to have growth restriction both before delivery and after to meet criteria for fetal alcohol syndrome, and also will have learning disabilities for life.
Wow.
Oh,
Oh,
that last one though.
I know.
Um,
Yeah.
It's interesting what you said earlier too, how it can change the trajectory. So if, a mother did come in who was consuming alcohol and you all noticed this baby, the growth isn't where it should be and it was due to this. If the mother was like, okay, I am going to stop my alcohol use and truly did, it will, like the baby can get better. The baby can grow.
Correct.
Yes. Oh, wow.
Correct. You can change how small baby is by stopping alcohol growth or use in pregnancy.
Wow.
That's incredible. And
That
also,
is.
like, I think that there might be a lot of moms who get themselves in that situation and don't think that it can make a difference. Like, oh, I already
Yeah.
drank
Yeah,
or
it's like
I
it's too
already did
late,
it,
you know.
and to know that, like, it's very empowering to know, you're always able to make a choice that can change
Yeah.
the trajectory.
Definitely.
Okay, so the alcohol affects the fetus by making it smaller and the learning disabilities, I'm guessing, does the brain stay smaller? Is it harder for fluid to get in? I'm just trying to think of all the things I know about like brains in a fetus.
Yeah, yeah. So there's kind of two parts, I guess, to alcohol effects of pregnancy. So the most common one we see is right, she didn't know she was pregnant. She was 5 weeks, went out with the buddies and had a few beers, and that's what I would say is the most common story I get. And then, the next day she had a positive pregnancy test, or she started feeling nauseous, and it continued and took a pregnancy test. And so early alcohol use, usually before knowing you're pregnant, is going to affect the growth of the brain and can actually cause that fetal alcohol syndrome. We think the most severe form is usually from that, is from very early consumption. And so that's one of the reasons that we stress in preconception, or I always say, if you're not using contraception and you could become pregnant, that you are trying to conceive in a way, and you should not be drinking alcohol. So when I decided to get pregnant all 3 times, I stopped my drinking. I definitely am a social drinker at this point in my life, but I would say that that was my number one thing, was I wouldn't get around alcohol. I didn't want it, accidentally exposed to my baby. And so as soon as we thought we wanted to get pregnant, alcohol was the first thing I cut out.
Wow.
Wow.
That is
Wow.
so powerful
It
and
is.
needs to be spread and talked about more. Definitely.
Yeah.
I think that that is so important for women to know that that period of time is so crucial.
Yeah, well, because even it's so common for women. I mean, I did this like
Yeah.
because I knew at 4 weeks when I was pregnant, but I said the whole thing, well, most women wouldn't know right now. And so I did. I took a final shot and smoked a cigarette and then was like, okay, then now I'm done, and
Yeah.
I feel like I've talked to other moms about it and they've done the same thing, like, oh, most women wouldn't even know at this point. So one last thing, but it's like, oh my gosh, that's even more,
It's so
it's
crucial.
so crucial, and it does it like, it's just,
I don't
ugh.
think that it's just talked about enough,
Yeah, no,
seriously.
really. And
So thank you.
yeah.
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 Okay. I
I
would
was
love
not
to
going
hear
there.
your opinion on how like red wine. When did that come into pregnancy? When it was okay to have a glass of red wine? Like, I feel like I'm skipping some
That's
questions,
okay.
but
It's
that
okay.
is like one of the most like being things in my head. Because even while we were pregnant, we were both pregnant at the same time for two of our babies. We were offered champagne and we were offered wine, and we were both kind of be like, no, like we're okay, thank you. But that's I feel like such a common thing for
Especially towards the end of
yeah, towards
pregnancy.
the
I
end.
know that like towards the end, I was offered a lot of red wine to like speed things up or because we were so close to the end.
Yeah.
And it seems like probably no amount is safe.
Yeah.
I'm gonna guess, but
Yeah, yeah. And that's the second part. So fetal alcohol syndrome is that first part early. And then we know that drinking throughout pregnancy is sort of linear. So like that no matter how much or how little you're drinking, if you are consuming alcohol during the rest of pregnancy, that's when growth restriction can happen. So you can hamper the growth of baby through alcohol consumption, even small amounts. So that is why still our professional societies, the American College of OBGYN and SMFM, or the Society for Maternal Fetal Medicine, say no amount is safe in pregnancy because we know that it crosses the placenta and we know that it causes differences in babies, specifically being smaller, doesn't cause the brain differences so much, and therefore is affecting the baby.
Wow.
Wow. What about are the facial features affected more so in that first 5 weeks, or is that something else that can be affected after?
Yeah, no, that's specific to fetal alcohol syndrome. So yes,
Okay.
that's from the early drinking. Yeah.
Wow.
Um, okay. So do you, as a health practitioner, are you able to tell if someone is fibbing about their alcohol use uh, by scanning them or by scanning the baby?
No, definitely not at all. I also 100% like I put faith in patients. If you tell me you don't drink, I'm going to say, okay, I see brain differences. I see a small baby, but it must be from something else because you said no. I believe you. I do.
That is
Oh, I know that
so,
actually gave me the chills
yeah.
because I honestly feel like a lot of people don't.
I
Is
was
that right?
I was in a meeting where another nurse had said that she was taught that whatever somebody told them to times it by three. Um,
Yeah.
and so it's so, and I think that that's no fault to her own. That's a very, like, okay, let's think about that because a lot of time people are fibbing. But honestly, the best way to care for someone is to take them for their word and exactly what they say. And that is very powerful.
Yeah. Yes, it is.
Um,
Are there times when you like, never mind, because you just said you believe them. I was gonna say where you clearly know that they're lying to you, but they're still saying they're not, but I don't.
yeah,
Yeah.
she believes.
Yeah. I
Yeah.
mean,
No.
I would say is where that happens more is substance use, right? And what happens is like someone comes in and they appear intoxicated and agree because we do ask if, to a urine test and the drug test is positive and they say that they didn't do, whatever.
Oh,
That would
okay.
be the situation where I'm like, okay, well, your drug test was positive for cocaine. So I think you consumed cocaine. And
Okay.
that's the situation where I would talk to someone about that. But usually I try to give them an open-ended and say, we did a drug test.
Yes.
Yeah.
So
Yes.
tell me
No,
about your
totally.
drug use,
Yeah.
Yes.
after
Okay.
they've consented too. That's very important because I don't think, and it gets sticky, right? Because with babies, with newborns, they'll test meconium, which is the first poop, and that they can see both alcohol and all substance use, cocaine. They test it for marijuana, and so that can be used as far as custody things. So it can be
Wow.
really hard, and that can be done without consent because the baby's the patient.
Mm.
Wow. Dang.
Um, do you see that substance abuse and fetal alcohol syndrome are they usually come hand in hand? Um, or is that kind of hard to differentiate?
Yeah, I think they often do, right? And I think a lot of that is situational too. And there have been interesting studies. They were more from the 90s, so they're a little bit dated at this point, that looked at does fetal alcohol syndrome present more commonly in certain demographics? And they found that women that are highly educated, that are consuming the same amount of alcohol as someone who's maybe in a lower class, worse situations, a lot more socioeconomic stresses, that those women were less likely to have a baby affected by that early fetal alcohol severe syndrome compared to women in lower classes or who had more socioeconomic stressors, is what I would say. So maybe less education, less access to money, more of a turmoil in their social situation as well. So that was a really interesting study that it can affect people in many ways. And it's also not just alcohol, right? It's not just substances. It's the entire picture of who this person is. And just saying, so, if you only stop the alcohol, but you're, being abused by your husband, you don't have any way to get out, you're living, with 20 other people, like there's so much other things that we need to work on as well that go hand in hand with substance and alcohol use.
Yeah.
Yes.
I mean, and
Agree.
this is very minute, but even like nutrition, it was so hard for me to eat healthily and like to, because
Girl.
yeah, no, like that was a struggle without pregnancy. And then with pregnancy, it's like, oh my
Yeah.
gosh, I actually need to eat better food for this baby,
Yes.
and all of that. And gosh, yeah,
It's probably so hard I don't know, just to take on all the stress. We know what stress does to the body, and then
Right.
have all those factors, but also the stress that comes with any kind of abuse or addiction of a substance too, like hangovers and stuff like that. It's just so sad
yeah,
to think about all of that stress being put on a person and a baby. But
Yeah. No, definitely. Yeah, and I think that sort of, remembering all of the different factors as well and trying to help these women as well and being able to be a place where people can talk about it if they choose to later. I've had a few patients that, the first time we come together, I ask my usual questions. So I always put my pen down when I start to ask these and I say, we ask these questions of everyone. How often do you drink alcohol? And they said none, and I said, okay. How about tobacco? Do you smoke? No. How about any recreational drugs? And say no. And then later at another visit, be like, you know what, doc, I can't stop drinking. I've had 3 or 4 beers every night because I'm stressed with my work and I'm worried about school, and I just didn't feel comfortable, but I wanted to tell you, and that's so empowering to me too. I feel like we're building a relationship, and don't feel like you can't later say something else. That's okay. And so I feel like it's really empowering to me when people feel that comfortable, and it's also totally okay. And we're here to help you. I ask those questions to try to help, not because I'm trying to judge.
so
yes,
good.
it's so important too. And that honestly, that same situation, it wasn't with alcohol or that, but I first with my OB, I did not feel like she was connected to me. And then finally, I think it was like the fourth appointment, my husband like nudged me because I was like, we need to find a new one. And I just asked her, I was like, do you not like me? And she was like, excuse me? And I was like, you're just not very friendly and you don't seem like you care. And she completely, was like, I'm so sorry that you feel that way. And then we just like after that totally vibed and she knew and like all of that. But she was like, thank you for telling me that. I would have felt really sad if you stayed with me and thought I did not like you for this whole pregnancy. And so I do think just having such open, honest communication with your doctor and not being afraid to talk to them, almost like in a therapy realm, like why am I gonna hide all of this from you? Like I had so many things that were going on, but I was like, she doesn't care, she doesn't like me,
Yeah.
things like that. And then once that, she was like, is there anything else you want to tell me? And I'm like, well, actually, listen to this. And so then
Right.
it was just
Right.
a completely different thing. But yeah, no, that's so important.
Just to know that you have a safe space,
Yeah.
right? Because I think a lot of time, anytime you're in a room that has maybe like big overhead lights and you're getting asked questions about your life, you can feel like you're, on trial or like, I get anxiety even now answering these questions, and I've been like alcohol free for 6 years. That question and answer portion, it feels like, oh my gosh, do I have to say the right answer? And to just give women a space to know, like, listen, whatever you feel like saying or whatever you feel like don't saying is okay. And
Mhm.
I'm not gonna, I think a lot of time people forget that, like, you guys can't tell anybody stuff like,
Yeah.
like there's a law.
There's literally a law against that.
Yeah.
Yeah.
Literally a law about it. And that's when I started kind of changing how I talked to doctors, is really when I told myself that over and over again. I'm like, this is a safe space. They just want to help you, And so to be able to provide that for women in this, it's so important.
Yes.
My son was diagnosed with ventriculomegaly.
Yeah.
Say that right?
You did.
they thought that he had schizencephaly.
Ooh.
And so there was a lot of people in the room, and they told me that. But after further testing, he did not have schizencephaly, and he had ventriculomegaly until he was born. But that kind of all resolved, and so um, that experience was very traumatic for me.
Very. Oh,
And I didn't have the pleasure of having an MD like you when I was going through that. So it's so important, and it really is can be such a scary time. I remember being in that room after being told something like that, and when they told me there was like six people in the room, and then everyone kind of slowly trickles out. There's like the person, patient advocate or something that stays there last, and then just like sitting in that room and feeling alone. I remember that feeling, and so it brings me so much joy to know that women don't have to do that when they're with you. you
yeah.
I
know?
try. I try. Thank you.
Yeah.
Yeah. It's, and it's so hard too when I tell people awful things. I always feel like there's never a good way, and it's always, just a sort of something that has to come out. And then I try to give people time, exactly like a few minutes to cry it out together, and then try to come back to see where we're at. But it's tough. And I know I've not hit the nail on the head with everyone for sure, but I really try to bring that comfort when I can.
Yeah.
Yeah. Oh,
So say that there is a woman that is listening to us who in the future might become high risk or is going through a high risk pregnancy currently. What is some advice or something that you would like to say to them?
Yeah. One of the biggest things is, I guess, depending on the reason for high risk, maybe clarifying with your doctor, because I feel like a lot of people get really stressed about like being advanced maternal age, for example, like I was AMA over 35 years young. And clarifying how much does that increase your risk really. And so I tell people that yes, it increases the risk of your baby passing away, but that's a 1 in like 150 chance, so that's very, very low. And now it's like 2 in 150, so yeah, it's doubled, sure, but the absolute number is tiny. That means 148 times your baby's going to be totally fine. And overall, depending on what's going on, the risks are probably smaller, but we say high risk and we say there is increased risk, but I feel like it can help people a lot to clarify. So knowing that you can have a healthy pregnancy, having a high risk pregnancy, you can have a beautiful birth in whatever setting you want within a few parameters. We have our preferences for sure. And to talk to us, like to tell me, what's important to you, what exactly, like you said, like say, do you not like me? Like talk to us about
yeah.
like how you're feeling, what's going on, so that we can be there for you in the right ways. Because exactly, like we try to ask, I try to make those things, but maybe you say like, I'm really scared because you told me, for example, an anomaly, like my baby has a club foot. So my baby's foot is turned the wrong way. And I'm scared that that means my baby will never walk. Tell me more about that. And I'll say, like in that case, it's totally cosmetic. They actually put casts on their feet or sometimes have to do surgery before they're one. So they never experience that in a walking age. So they're
Wow.
gonna walk.
Yeah.
So if those moms that don't ask that question are like, oh crap, like my baby's never gonna walk, like this is a permanent anomaly, everyone's gonna make fun of my kid their whole life. And so I feel like asking or talking about those fears you have, please bring them to me, bring them to your doctor and say like, hey, how much does this increase my risk? What is, those kind of things. Basically bring your fears. I like it. Yeah.
Yeah.
No, that's so important because a lot of moms, at least some that I know, and I'm speaking from my experience, 100%. I think that the last thing one of the ladies told me before I left that day was don't go Google it. And that's exactly what I did. I mean, please don't tell me
Absolutely.
not to do something, but I did. And I think a lot of moms do that. They go to Google, and Google is going to tell you the craziest, like all of the things. Google's going to tell you all of the things that are true, not true, and everything in between. And so to be able to just like get permission, sometimes people need permission, like go ask your doctor.
Yes.
Don't Google it. Like,
Yeah.
because that is such I didn't know that about club feet, and I felt like a breath of fresh air as you explained that.
Yeah.
Like it feels like, oh my gosh, okay, the world is not closing in on me. And sometimes when you're scrolling, the world is closing in, it feels like.
Yeah.
Absolutely. Or also Google it and bring it to us. I've also had people like they Google the thing and it's a different thing than what they thought it was. And so they bring back what they find. And I'm like, oh, no, no, that's not what your baby has. And so, like,
Ah,
do bring it back. It's okay.
Yeah.
If it's
yeah.
something you're like, I'm terrified because I found this on TikTok, bring it,
Yeah.
please. I'm
Oh
on
my
TikTok.
gosh. I
It's okay.
know. I can't believe that I don't think TikTok existed when I was pregnant. That makes me feel old.
I'm like, wow.
Like,
No,
did TikTok?
all of our baby pictures are the ones with the Snapchat filters on. I
Yeah.
saw something the other day that was like, how do you know you had a baby between 2017 and 2019?
When
And
they
it
look
was
like an old person
with
or
like
like
the
the
bear.
deer.
Yeah. And little
Yes. So
glasses and little babies.
Oh,
Um, but yeah, no, thank you so much because I really feel that we get so nervous to talk to our doctors. And that needs to change. And especially in a time of your life like motherhood, it is one of the most like you're beautifully nervous, but you're also beautifully terrified, and you're scared of absolutely any and everything happening to your baby. So to be able to have such open communication with someone who actually knows what they're talking about, I feel like that is such a priceless gift to give a mother.
yes.
Um, and all the stuff that you've said, like it feels really like anybody who is struggling with alcohol use and wanting to conceive or does conceive, like they are able to change the trajectory of what they're going through and what their baby is going through. That is
Yes.
something that can happen. So thank you so much for bringing such wonderful points to us.
Yes. And two, thank you for staying in New Mexico.
Oh my girl,
Well,
so
no,
clap,
because a
so clap
lot,
for
well,
that.
and not to like be mean
Yes.
to anyone else.
Yeah.
But also, I feel like a lot of native New Mexicans, they get their degrees, they go away, and then they don't come back. And I'm like, no, we need you.
We
You
need
know
you.
how much
Yeah.
we need you here, and the support with everything. And so thanks for sticking around and helping our
Really,
people.
yeah, really cool. Everyone's a Lobo.
Yeah,
that's right.
we
Everyone's
are.
allowed.
We are.
Really.
Yes. No, I
Oh,
hope to stay forever. And I like to, I feel like as an OBGYN, not to get super political, but we do have to advocate for patients. And so I do spend some time at the Roundhouse for various, related bills, let's say.
Yeah.
And it's for physician advocacy, because it is a really hard sell to people not from here, right? That
mhm.
don't love New Mexico like we do.
Yes,
But the
yes,
because we're at less than the third percent for salaries for physicians. We're incredibly litigious. We do have a lot of suits brought against people, and so it's a really hard place to practice. But it's something that we're working on, and I agree. We're trying to bring more people to our land of entrapment in a good way.
yes,
Yes,
yes. We are very proud New
we
Mexicans.
are.
We are. We always try to show the beauty of it all.
And showcase the wonderful people that have chosen
Yes,
to build their lives here and help other humans
yes.
because that is so important and needed.
Thank
Um,
you. Yeah, yeah. We do outreach. We have a clinic in Las Cruces and Grants in Santa Fe, and we do read ultrasounds remotely for Taos, Raton, Silver City, and I think that's it right now. Yeah.
Wow.
So
wow.
all over the state.
For our listeners, will you tell us what the
Where they can
place,
find
yeah,
you.
where they can find you?
Yeah, yeah. I'm at Pinon Perinatal, so it's a private practice based mostly in Albuquerque, New Mexico.
Okay.
Yay.
Yay.
I went to Pinon with my first.
Did you?
Oh,
Oh, that's
oh,
cool.
Well, thank you so much, Elizabeth. You are a wealth of information
Yes,
there. Like you could just continue, and we probably have so much more that we could talk to you about. And I just really appreciate your honesty, your openness, and your warmth.
yes, yes.
thank you guys so much. I'm honored to be on your podcast. Thanks for having me.
Oh, thanks.
Well, we appreciate you so much. And listeners, we hope that you got a lot out of this. Mamas, we love you so much. Everything we do is for you.
Yeah.
Yes, we love you, babes.
Talk soon.